The Philippines is leading in the rise of novel coronavirus or COVID-19 cases in the entire Western Pacific region. Data from the World Health Organization or WHO showed from June 16 to June 27, COVID-19 cases in the Philippines jumped 8,143, placing it ahead of the 22 countries in the region. It was trailed with a big gap by Singapore, which registered 2,351 cases, also China, which recorded 302. The Philippines has the third most number of COVID-19 cases in the region as of June 27, with 34,803 cases, following only China with 83,500 cases and Singapore with 43,246 cases. Both China and Singapore have been aggressively testing its population for the virus, while the Philippines still struggles to extend or expand its testing capacity. The country placed second with most number of deaths as it recorded 1,236, a high number in proportion to its infections compared to both China and Singapore, which reported 4,634 and 26 deaths, respectively. The uptick in the Philippine cases coincide with the government easing its lockdowns and increasing its testing capacity, which is still limited to targeted swabbing. On Sunday, June 28, the Department of Health said that the comparison made with Singapore and other countries requires a deeper understanding of the population ratio versus number of cases. Singapore has a population of 5.9 million with 43,246 coronavirus cases. The Philippines population is 109 million with 34,803 cases. Per 1 million people, Singapore has a higher case at 7,393 cases per 1 million population compared to the Philippines, which has 318 cases per 1 million population. Singapore has a lower case fatality rate or CFR at 0.06% or 26 deaths per 1 million population. The Philippines registers a 3.6 CFR or 1,236 per 1 million population. In an update statement, the DOH corrected itself and said Singapore's death per million is 4.4 deaths per million population, while Philippines has 11.34 deaths per 1 million population. This is still low compared to the global CFR of 5.1% as the national government strives to manage COVID-19 in the absence of a cure or vaccine. All agencies are tasked to closely monitor the rise in cases and strengthen our response through localized actions, especially in emerging hotspots, the DOH said, adding these localized responses entail early detection of cases and tracing of contacts, their immediate isolation or quarantine, and appropriate testing and treatment. We have also addressed the rising critical care utilization through augmentation of equipment and workforce to ensure that we can manage possible surge of cases. Lastly, we continue to emphasize the implementation of minimum health standards, example, wearing of mask and physical distancing as the most effective preventive measure in the absence of a vaccine. In the latest update, the DOH also noted that the Philippines and Singapore vastly differ even in the socio-economic context even before the pandemic. These include the living conditions and the health system capacity. Please take that into account when we do our analysis. Let us not cherry-pick the countries we want to compare ourselves to, the DOH said. In a statement, Opposition Senator Francis Pangilinan said that the WHO's assessment was embarrassing to the Philippines, neighboring countries, and the Filipino people. This is embarrassing to the Philippines, neighboring countries, but it is more embarrassing to the Filipino medical and health workers who put their lives on the line to face the virus. To everyone who have followed and have been following several and often confusing guidelines of the government, such as easing of the lockdowns but without public transport. For Pangilinan, contact tracing, and mass testing, which should have been done during the lockdown, are still the public health measures that government must implement in controlling the spread of the virus. We have been saying, proposing, appealing, included in Bayanihan 2, there should be a mass testing and contact tracing. This will not be solved by military or police posturing or signing the Chacha or federalism. Pangilinan said any government should be taking care of its people, especially during the pandemic. Attend to a well-being of everyone, especially the most vulnerable, those who have nothing. Government must not ignore. Government must not hurt. Government must care.